Hello, I'm Kathy with the Massachusetts SHINE program. SHINE stands for Serving the Health Insurance Needs of Everyone, meaning everyone on Medicare. We are a federally funded, free and unbiased health insurance counseling program under the Administration for Community Living, which is part of the U.S. Department of Health and Human Services. Today I'm joined by Kathy Devine, Outreach Coordinator for the Massachusetts State Pharmaceutical Assistance Program, also known as Prescription Advantage. Welcome, Kathy, and so great to have you here today to help explain the Prescription Advantage program and how it helps Medicare beneficiaries and others in Massachusetts as well. So anyway, let's start with the basics. If you could give us a little bit of background on the program, the history of the program, and who it's designed to help.
Okay. Thanks for having me. I really appreciate having this opportunity to talk about the program. And as far as little history, Prescription Advantage, to the surprise of a lot of people, has been around since April 1st of 2001. So here we are now in 2021, which means that Prescription Advantage is going to be 20 years old very soon. And you know, it's when Prescription Advantage was first developed, it was because there was nothing else. People with Medicare did not have prescription drug coverage at that time. If people were over 65, they had nothing. They paid full price, you know, unless they had any access to a private insurance. There was no other coverage. So Prescription Advantage became a primary coverage, and you know, there were income limits, and what people paid in copays depended on what their income was. We also actually at the time charged a monthly premium for it, so it was like having a little insurance. But things changed in 2006, and that's when Medicare, I want to say finally, when Medicare implemented prescription drug coverage. So that's when Part D first came about. And because we had so many members who had Medicare, that's when we sort of shifted and we said, well, you know what, you're eligible for Medicare, and now you have Part D available to you. So we said, you know, you need to get a Part D plan because you're eligible for it, and then we will become a secondary payer. So we then became really more like a supplement for those who are eligible for Medicare.
Okay, wow. So is Prescription Advantage then an actual prescription drug plan?
Well, sometimes it's hard to describe it because it really is not an insurance, even though we act like an insurance. Mm-hmm. We are what is referred to as a state pharmacy assistance program. And that's how Medicare recognizes us, as a state pharmacy assistance program, which means we are funded by the state. We don't have any federal funding. It's totally state funded. And we are we're there to supplement, or in some cases, which I'll go over, is that we are a primary insurance for other populations.
Okay. So in SHINE, we often get asked a lot of questions about the coverage gap, otherwise known as the donut hole. And it would be helpful, I think, for those viewing this video to hear an explanation of what the coverage gap is, how it works, and then also how does Prescription Advantage play a role as far as the coverage gap is concerned.
Perfect. The coverage gap, okay, also known as the donut hole, it's a gap in the Medicare Part D coverage. And it doesn't matter what plan you have, or if you have a Medicare Advantage plan that includes prescription drug coverage, they all have the same benefit structure. So they all have that gap. And you reach the gap when the total retail cost of your prescriptions reaches a certain amount. Now, that amount changes every year. And for this year, in 2021, the amount is $4,130. And, oftentimes people are very confused by this, but it just shows that they really don't understand how it is you reach the gap, because most people that we talk with, they're focused on what they're spending out of their pocket. And, we hear it so often, oh, I would never spend $4,000. I'd never reach the coverage gap. And, to their surprise, they didn't have to, because it's the retail cost. So if you think of a prescription, let's say it's an inhaler, and we know how expensive those can be. But let's say it's an inhaler, the retail cost is $400. Well, with the individual's Part D plan, their copay for that inhaler may be $30. But if they're paying $30, then that means their plan is paying the other $370. So you add the two together and you get to that's how you get to the retail cost. And that's the amount that the plan is keeping track of. So if you had that inhaler and say a few other prescriptions, all of those retail costs are getting added together and they're accumulating from 1 month to the next. So if you had even something that, 3 or 4 prescriptions, if the total retail cost of all of them added up to $700, let's see how my math is, 6 months times 700, that's $4,200. You're in the donut hole.
Absolutely.
You've reached the gap in June. So much to so many people's surprise. So what happens? Using that example of the inhaler where somebody was paying the $30, well, once they reach that gap, the individual is now responsible for 25% of the retail cost of the drug. Right. So that $30 copay just went to $100.
Yep. Yeah.
Can you imagine?
Oh,
can you imagine the surprise? Somebody's standing at the pharmacy with the $30 in their hand, only to hear that'll be $100.
Yeah, a little bit of sticker shock, definitely.
It is. Yeah, it is. So, and that's where, for many of our Prescription Advantage members, this is when their coverage begins. It begins at the point when they reach the coverage gap. So oftentimes I hear from members, they're like, well, Prescription Advantage, they haven't been paying anything yet. And, we're looking like, well, you've only had, a few $100s worth of prescriptions to this point. But as the year goes on and as their costs are accumulating, but I have to tell you, we have people that we started paying for in January. So,
all it takes is one very expensive medication, right?
Absolutely. Yeah. Absolutely. So this is when Prescription Advantage can help to lower those costs.
Absolutely. So what are the eligibility requirements for being in the Prescription Advantage program? Who's eligible to participate?
Who is eligible? Okay, let's think of this as a Prescription Advantage umbrella. And under that umbrella, we have 3 different groups of people that we provide benefits for. And they're all very different. The first group is people who are age 65 and over and not eligible for Medicare. And so many times I've heard, well, how could that be? I thought once you turn 65, everybody gets Medicare. And not necessarily the case, because it really depends on, did you contribute to Social Security? And for X amount of years, whatever it is, and whatever amount, who we find often in our membership are people who may have moved to this country later in life. And I often think of people because I actually have neighbors that, the daughter came to this country from China to go to college, and she never went back. And she got married and, went on to have a family. But then her parents over in China were getting very elderly. So she brought them over. So, but then they are eligible for Prescription Advantage. because
That's
they're
right.
not eligible for Medicare.
Yeah.
And with that particular group, because some people, maybe they are working, they might be on the younger end and they are working, but still not eligible. The benefits that we have, we would be a primary prescription drug coverage. Benefits are sort of on a sliding scale based on income, but there's no income limit. So it doesn't matter if they are working, what they make, we can plug them in to one of the categories. Then the second group are people who are under age 65. Okay, under age 65 with a disability. Now there is an income limit, and like so many other programs that we talk about, with state and federal programs, everything always seems to have an income limit, and it's always based on a certain percentage of the federal poverty level, and no two are ever the same. So, and we're guilty of that as well, because our under age 65 with a disability, income cannot exceed 188% of the federal poverty level. But just to give you a number to associate with that, if it's a single person, that would mean income cannot exceed $24,214. If it's a married couple, income cannot exceed $32,750. And when somebody is under age 65, with a disability, if they're not yet eligible for Medicare, Prescription Advantage would provide them primary prescription drug coverage. But at some point, and I believe it's 24 months that they've been disabled, then they become eligible for Medicare. So even if they're still under age 65, once they become eligible for Medicare, then we would say, okay, you need to get a Part D plan or a Medicare Advantage plan, but we will still be able to help provide you with some financial assistance to lower those copays. We'll become your secondary payer. So that's two of our groups. Third group, which is actually the folks that make up the majority of the Prescription Advantage membership. These are people who are age 65 and over and eligible for Medicare. So with that group, yes, we are a secondary payer. Income level for this group cannot exceed 500% of the federal poverty level, which for anybody who's used to hearing these numbers recognizes that this is a very high number compared to a lot of other programs. Absolutely. So 500% for a single person, that would be $64,400. And for a married couple, it would be $87,100. So the income levels go up, they're pretty high. But again, the benefits that we provide are going to be determined by what the individual's gross income is. And then we put them into a membership category, and then that determines when their benefits start and what their benefits will be.
Okay, all right. Many folks feel they're disqualified from certain assistance programs because they have a few dollars in the bank or they own a home. Is that an issue when applying for Prescription Advantage?
I'm glad you mentioned that, Kathy, because I get so carried away with talking about income, I tend to forget, and this is so important, we don't look at assets. And if somebody has money, they have a little savings account, okay, we don't count that. Or people often think because they may own their home, we don't count that either. Something that we would count as income, though, is, let's say somebody had a 401k plan, or or some type of an IRA or whatever. We're not looking at the total amount, that 401k, whatever the total amount is, that's an asset. But once you start taking withdrawals, once you start taking
Okay.
disbursements, so think of it as any money that now can go into your pocket.
Mhm.
We do count that as income. Or as I like to tell people, anything, if you receive a 1099 for it, then it's
That's a
counted
good
as
rule of
income.
thumb to follow. Wow. That's
Yeah,
great.
yeah.
Yeah. So we often see folks at Shine that are eligible for other programs like Extra Help or some of the Medicare
Mhm.
programs. How does that work as far as eligibility for prescription advantage?
Yeah. Okay. There are those two different programs that, with Prescription Advantage, part of our application process is that we are screening people to see whether or not they may qualify for either Extra Help or the Medicare savings programs, which of course those are also known as the Mass Health buy-in programs.
Right.
If somebody, based on the information that they provided us in their application, and also based on what their income is, if it appears that they may qualify for Extra Help, then Prescription Advantage will even assist, will help them apply for it. If they qualify for Extra Help, they can have both. They can have Prescription Advantage and they can have the Extra Help. That's fine. We want them to apply for it because Extra Help is going to lower their copays. We will also lower their copays, but in this case, we're going to let Extra Help do it first.
Right.
And then,
Right.
then
Exactly.
we will do it. So you
Okay.
can have both. But now what's different though with the Medicare savings programs, if somebody qualifies for a Medicare savings program, then they do not qualify for Prescription Advantage.
Okay.
And again, you know what? If they qualify for a Medicare savings program, they really don't need Prescription Advantage because their benefits are they're getting financial assistance to help lower their copays, and they're being lowered to rates that are even lower than what Prescription Advantage would be able to offer.
Yeah.
And they're also getting additional benefits too. So
Yeah.
when
Makes
we
sense.
see that, we want to, let them know you are much better off with this.
You don't
apply
mind letting
for
them
it.
go, right? Right.
Exactly. Right.
Okay, good. I wanted to ask you before, what if someone doesn't have a drug plan? Would they still be eligible to apply for Prescription Advantage? How would that work?
Well, let's talk about those who are eligible for Medicare. Okay.
Okay.
And as we know, a lot of people, when they become eligible for Medicare and they don't take any prescriptions and they say, I'm not going to pay for a Part D plan.
Mhm.
If I'm not going to receive any benefits from it. And then the situation changes. And all of a sudden, here they may be a few years into this and now they're getting prescriptions and it's not during Medicare's open enrollment. So Prescription Advantage being that state pharmacy assistance program, one additional benefit that people get just by being a Prescription Advantage member is that they can join or change a Medicare prescription drug plan outside of Medicare's open enrollment.
Fantastic.
So I know Shine counselors are well aware of this because they use it all the time. They get people onto Prescription Advantage. We're not going to pay anything for them because they don't have a drug plan yet, but now they're able to get that drug plan. Now they have both. And if they reach the coverage gap or whatever, we can help them.
That's terrific. So even if someone isn't in the donut hole, there's still the benefit of having that special enrollment period.
Absolutely.
Absolutely. Everything we're hearing so far is great. So how much does it cost to join Prescription Advantage?
The first two groups of people I mentioned, over 65, not eligible for Medicare, under 65 with a disability, free. Okay. over 65 and eligible for Medicare, okay, we only have one membership category that does pay an annual enrollment fee, and it's $200 a year. But those are our members at the, the highest income range. But anybody else, in categories lower than that, they pay nothing. It's free.
Incredible for what they're getting for it. Absolutely.
Exactly.
What if you're, do you work with folks that might be on an employer drug plan, as an example? Is Prescription Advantage able to work with plans?
Yes, and we do.
Okay.
I know we tend to focus on Medicare because that does seem to be the majority of our membership, but we still do have members that have other prescription drug coverage that's not a Part D plan. It could be that it's something from a former employer or through a union. As long as they meet the eligibility requirements in terms of income, they're not exceeding income guidelines, will be a secondary payer to any other insurance. So people with other insurances, they don't have a coverage gap because it's not a Medicare plan. It's not structured. The benefit structure isn't the same, but the benefits we provide would be the same.
Understood.
So we could still have people that, we're not going to provide assistance until the total retail cost of your prescriptions reaches that $4,130.
Okay.
Then we will jump in.
Okay. And would that work with veterans coverage as well? Same thing?
Mm-hmm.
Oh, wonderful. Great. So does the membership, if I enroll in Prescription Advantage, does my membership roll over every year automatically? Do I have to reapply every year?
Automatically. Okay, we don't require our members to reapply. What we will do periodically is a redetermination where we just check in with our members. We'll send them something to say, okay, this is the information that we have on file for you. This is what we have as your income. This is what we have as your marital status, just kind of a picture of who you are in terms of, where you are in our database. And then we ask, has anything changed?
Mm-hmm.
And at that point, we may ask for updated income documents. And because sometimes, sadly, people might lose a spouse. And if they didn't tell us, losing a spouse may also, means that they lost a certain amount of their income.
Absolutely.
And maybe they could be in a lower income category or just a different income category that would provide them with a richer benefit.
Absolutely. Wow, that's a great point. So is there a specific enrollment period for one to sign up for Prescription Advantage?
Prescription Advantage is open year-round. We don't have a little window of time like Medicare with their open enrollment period. No, it's 365 days a year is open. So
that's terrific.
And I think it's really important that we are able to enroll people at any point in time, because people reach the donut hole at any point during the year. And, we want to be able to help people at a point when they really need us. So that's why we just keep it open.
Great. So how does one go about applying for Prescription Advantage? Can you talk about the application process a bit?
Yeah, we have 3 different ways to apply. Okay, we have an application form, and I know, Kathy, you've seen the form a million times, and it's almost an oxymoron to say it's a simple government form. But
right. It's one of the shortest I've ever seen.
It is. We don't ask for a lot of information, and it's an easy form. Another way to do it is through our website, and which is www.prescriptionadvantagema.org.
Okay.
And on our website, we have an online application. So for people who are comfortable with doing their own entry, you know, they're computer savvy, they're like, I can do this. You can just enter it yourself. Or when you're on our website, that's where all our forms are too. So you can easily just print them off.
Okay.
And the third way, which often is my preferred way of doing it, is to do it by phone. And that would mean calling Prescription Advantage directly. And their phone number is 1-800-243-4636. Okay. Call Prescription Advantage, and you could ask them to send you an application, which they'd be happy to, but you can also say, can we just do it now? And our customer service reps would be very happy to just do it over the phone with you. But what I like about doing it that way is now you can have that one-on-one conversation with somebody. If there's something about Prescription Advantage that you're not really sure you understand how the benefit works, or you have somebody that can explain it to you. And the only thing is that once the application piece of it is done, okay, so whether it's by phone or by paper, the most important thing is we do ask for proof of income. And we are going to ask for income documents. And in our application, we do ask, do you currently file federal income tax forms? And if somebody checks off, yes, I do, then we're going to ask for a copy of their most recently filed federal income tax form. So that would be the 1040 federal income tax form. We need that. If Social Security is part of their income, then we would also ask for either the 1099 that they received from Social Security or a copy of the annual award letter. Okay, I think that usually comes out sometime in the fall. It's the letter that tells you what your benefits are going to be for the following year. So we do need, if you file taxes and have Social Security, okay, we need both the tax form and the Social Security document.
Okay.
If somebody checks off, no, they don't file federal income tax, because some people don't, then we would just go through, well, what do you have for income? And what do you, and any income that you receive would have that 1099. So if it's Social Security, you would have a document from Social Security. Maybe you've received a pension from a former employer, you'd have a 1099 for that. So it is so important, because I talked a lot about income limits and how can we determine what your income is if we don't have something to look at.
Yeah,
so,
absolutely.
And that's how we determine, are you eligible for Prescription Advantage, or could you possibly be eligible for those other programs, the extra help or the Medicare savings programs? Income is really what drives the decisions, and it does determine what a person's benefits are going to be.
Great. So Kathy, I'm going to bring up your website page again, so that it'll repeat the telephone number that people can call if they want to go online. It will also give the website address. And I assume people can get additional information off of that website, in addition to being able to apply or make a call.
There's so much information about the program. It is
Absolutely.
a good place to visit, because there's things that explain everything about Prescription Advantage.
Terrific. So Kathy, I want to thank you so much for doing this with us and providing us with your time so that we can make this video to educate folks about the Prescription Advantage program. I know the SHINE program greatly appreciates our partnership with you, and we both know terrific success stories that have really changed people's lives with this program. So it's a very, very important program to us and to the consumers in Massachusetts, and we appreciate the work that you do. Just a reminder to everyone everyone that you can also contact a Shine counselor in your area to assist you with the Prescription Advantage, learning more about the program, helping you fill out the application and so forth. And again, we'll put that website information up at the end of this video as well. So Kathy, thank you again. It was great to talk to you about this great program.
Thank you so much. Thanks for having me.
All righty. Here's a list of all of the Shine regions across the state of Massachusetts and a contact phone number for each region. You can also contact Shine through the Mass Options phone line at 1-844-422-6277 or via our shinema.org website. Please know that Shine is open for business during these challenging times, and our Shine counselors are here and ready to help you navigate your Medicare choices.